Great to meet you. Big fan.
Same here. Thank you.
Dr. Fauci, thank you so much for joining us on this Asp Chat. We really appreciate it.
Yeah, thank you for having me. It's really a pleasure. Thank you.
Well, look, as I think everyone knows, you are the director of National Institute of Allergy and Infectious Disease and President Biden's chief medical advisor. As the COVID situation keeps evolving, let's just jump into some of the most recent developments. Most notably, the FDA just recently fully approved the Pfizer-BioNTech vaccine for people 16 and older. Can you tell us a little bit about that process? Why is Pfizer the first to be approved? And should people still feel confident receiving other vaccines that have yet to still receive full approval?
You know, that's a great question, and that's what everybody's asking. So the good news is that the full approval, or the BLA, which stands for a biological license application, essentially equivalent to what most people colloquially call a fully licensed vaccine. Namely, it's got the imprimatur, the seal of approval. The difference between the Pfizer and the Moderna and the J&J really is a matter of the timing of the sequence of getting their data in to the FDA. So it isn't as if there's something strange about Moderna that the FDA is concerned about. It's kind of like a sequential submitting of data. And when you get all the data in, then the FDA meticulously analyzes it, goes over all the effectiveness data, all of the safety data, as well as things like the ability to consistently manufacture lot for a lot, namely to get it out to the general public in an unlimited quantity. It's really a very interesting distinction that I explain all the time, but you can understand why people somehow get it wrong. An emergency use authorization in its original intent was when you have an emergency situation and you have an intervention and you want to get it to people as quickly as you can, you quickly look at, is the benefit appear to be greater than the risk? If it is, you get an EUA. But very infrequently does an EUA have as much overwhelming positive data that it works and that it's safe. So the people who are still getting the Moderna and the J&J on an EUA shouldn't feel like now, well, wait a minute, we're a little bit less. It's just that now all the data that has gone into the BLA, or the biological license application, is that the FDA has now gone over the meticulous process of going over every single bit of data, dotting the I's, crossing the T's, determining the manufacturing capability, and now, boom, it gives it the stamp of approval. But that's going to happen almost certainly with the others sequentially within a reasonable period of time.
Last week, the Biden administration recommended booster shots for most Americans. Can you explain why that decision was made and how booster shots will further help protect Americans from COVID?
Yeah, well, great question, Chris. And you have to get people to understand, because there can be some confusion, because the first thing is, well, if you need a booster shot, does that mean the vaccines don't work? That's the first question they ask. And the answer is the vaccines work extremely well. So for those who might be hesitating to get vaccinated because they feel, well, why do you need a booster? The need for a booster, if you talk about the general population, and I'll explain it because there are so many moving parts here that people can get confused. Put aside for a moment people who are immunocompromised, and I'm going to get back to them in a second. People on cancer chemotherapy, people who have transplants, people who have autoimmune diseases, who are on immunosuppressive therapy. Put them aside for a second and look at the announcement that in September the 20th, we're going to start rolling out at the 8-month mark a third shot for the people who got the first and the second shot. The reason for that is that although the vaccines are extremely effective in protecting you from infection and ultimately for symptomatic disease and ultimately for hospitalization and deaths, we are finding now with our own data and with the Israeli data and data from other countries, because what's happening in Israel now is going to happen to us in a couple of months, because we're really parallel doing about the same thing. And you find that over time, the efficacy after several months of protecting you against infection and symptomatic. Now it's working fine, but we want to stay ahead of the game. So instead of waiting until it starts diminishing, in order to keep its durability over time, not how good it is, but how long it lasts, we're recommending the boost, which will bring up the effect very high. We already know from some tests we've done that when you boost somebody, a few months, several months, 6 to 8 months after they get their first 2 shots, the level of protection goes way, way, way up. So we're hoping that with the booster, you'll take a very good vaccine and allow it to last a much, much longer period of time. Don't confuse that with the fact that we're telling the immune compromised to get boosted right now, because they never really got a good response. Unlike the normal population that got a really good response, we just want to prolong it. If you are on cancer chemotherapy or a transplant or something like that, you never really got to the level we felt would be safe. So you want to get them up to that now. And that's why we're boosting them now, and we'll start to boost the regular population around September the 20th and beyond.
Does the recommendation for booster shots mean that so-called breakthrough infections are also becoming increasingly more common?
Yeah, and that's one of the reasons why. When I say the efficacy of the vaccine over time is starting to attenuate, that's exactly what I'm referring to.
Do we know exactly how many months the vaccine offers protection from the virus and when that protection begins to diminish?
Let's say all 3 of us got vaccinated right now. We would have a high degree of protection against infection and an almost 100%, not quite, nothing's 100%, but a very high degree of protection against hospitalization and death. As the months go by, like month 3, 4, 5, 6, you start to see a very, very gradual diminution in the slope. You're still in good shape, because even if you have a breakthrough infection, it's extremely unlikely you're going to get hospitalized and you're going to die. But as you get out more and more, and we figured right around 8 months, even though you're still protected well against hospitalization, you don't know whether it's going to be 10 months or a year. You don't want to get to that point. You want to, I use the Wayne Gretzky analogy. You want to skate where the puck is going to be, not where the puck is right now. So you want to be able to protect against what you think is going to happen rather than what's already happened. You don't want to chase after the virus. You want to keep it from giving you harm.
You spoke a little bit about this, but do you worry that telling Americans they're going to need boosters will dissuade them and dissuade unvaccinated people from getting their first shot of COVID vaccine at all?
No, I don't think so, because we have to be clear and articulate in what a booster actually is. And I've said it to you guys clearly, but all of us, when we talk to the people who follow you and we talk to other people, the vaccines, the one followed by the second dose of Moderna and Pfizer or the single dose of J&J really work well. We want to talk about keeping that going for a much, much longer period of time. So people who say, well, if I'm going to need a boost, why shall I get vaccinated? Well, you can't vaccinate a boost to somebody who hasn't been vaccinated to the first place. So you can't get to the second step until you do the first step. And that's the reason why the most important message that we can give people right now is there are 90 million people in this country who are eligible to be vaccinated who are not vaccinated. Those are the people who are getting to the hospital. Those are the people that are dying. So even though we have the vaccinated people having breakthrough infections, for the most part, they're getting protected against serious disease, where the unvaccinated people are unfortunately getting very sick, are getting to the hospital, and some of them are dying.
We're hearing more and more about long COVID. Can you explain what long COVID is and what the likelihood is of vaccinated individuals developing it?
Yeah, that's a great question, and that's what I think we got to make sure that we address. Long COVID is a syndrome of when people get infected, they get sick, minimal symptoms, moderate symptoms, or even symptoms serious enough to put you in the hospital. When you clear the virus from your body and you're so-called well again, a substantial proportion of those people, up to 30% sometimes, between 10 and 30%, have a persistence, a nagging of fatigue that can be profound enough to prevent you from functioning the way you want to, muscle aches, temperature dysregulation, sleep abnormalities, and what's called brain fog, which means you really can't focus. You're looking at your computer and you're trying to type, you're trying to write, and you can't focus, or you're trying to read. That's what long COVID is. The second part of your question, Chris, is what about vaccinated people? If you get a breakthrough infection, can you get long COVID? The answer is yes. It's less frequently among vaccinated people, but vaccinated people who get a breakthrough infection absolutely can get long COVID.
Do you think that communities where COVID is spreading quickly should, and is the high rates of infection, consider not letting their kids back into school or recommend that their workers stay home?
Well, workers stay home means lockdown. No way you want to recommend that right now. Recommend getting people vaccinated, and when they are in an indoor setting in a high area of transmission, which is most of the United States, when you look at the map, most of it's red or orange, then wear a mask indoors, even though you are vaccinated. When I say indoors, I don't mean at home with your wife or your partner or your kids. I mean when you go outside into the community in an indoor space, even if you're vaccinated, you should wear a mask. Kids in school, another story. We want to get the kids back into school physically present. And the reason is we have now about a year and a half of experience of what happens to the kids when you keep them out of school. You get deleterious consequences. You get mental health issues. You get social developmental issues that you don't want to happen if the kids are just doing virtual. So you want to bring them to school. But the big consideration is you want the safety of the kids to be paramount. You don't want the kids to feel unsafe. So what do? You can do a few things. You could just say don't go to school, which is not the best option. Or you can say we're going to surround the children with everybody who's eligible to be vaccinated will be vaccinated. School teachers, personnel in the school, bus drivers who bring the kids to school, anybody who comes into contact with the kids should be vaccinated. If you're 12 to 15-year-old and you're eligible to be vaccinated, you want them to be vaccinated. For the other kids who are too young to get vaccinated, that's why you say everybody in the school system should wear a mask. If you do that and provide proper ventilation in the school, get testing where appropriate in the school, you can get the kids back to school safely. But you got to do all those things that I mentioned. You can't, for example, have a governor say, I'm mandating that you can't wear a mask in school. I mean, what is that all about? That's mandating against a public health measure.
Well, to that end, what do you think the timeline is for administering vaccines for children under the age of 12?
That's a great question. If you're talking about that, you're talking about kids from 11 to 5, which are the elementary school kids. Right now, we have done age de-escalation studies vaccinating kids from 11 to 9, 9 to 6, 6 to 2, and 6 months to 2 years. We're doing it for safety, and we're doing it to determine if they induced an immune response that you would predict would be protected. We're getting enough data now that by the time we get to the early to mid-fall, September, October, we'll have enough information to present to the FDA to say, take a look at the risk-benefit of safety versus immunogenicity and efficacy. And the reason I say is not to make you think that there's any reason to believe it's not safe, but whenever you're dealing with kids, you've always got to add the extra notch for safety, which means the FDA may look at that, and in the mid to late fall or early winter, they may say, okay, it's good to go, or they may say, you know, we want to follow it for a month or two more. My prediction is that it likely will happen sometime this calendar year. I say mid to late fall. It might be early winter, but hopefully it'll be sometime within the first semester or the first term of this coming year, the fall year.
I know that this isn't typically the standpoint that you come from, but why do you think certain myths about the vaccine, that it was developed too fast, that it impacts fertility, that natural immunity is strong enough, why do you think these myths persist?
You know, it's the social media issue where anybody can say something and have an enormous audience. The good news about the reach of social media is when you're getting good, correct, important information, it gets disseminated very, very well. The dangerous part of the social media is that it is, you know, the garden for misinformation. It just sprouts up. And there's misinformation, there's disinformation, and that spreads like wildfire. So the only thing that we can do is what we're trying to do here now with this discussion is the best way to counter misinformation and disinformation is by disseminating correct information. Because, you know, the Surgeon General gave a report about a week and a half ago on disinformation, and that's really the enemy of public health. It is really the enemy of public health is disinformation.
Sure. Well, to that end, last question. What would you say your message to the Americans who are on the fence about getting vaccines would be?
Well, take a look at the data and make your decision based on facts. This is a highly, highly effective and very safe vaccine that has been meticulously looked at by the FDA, an independent agency. And those people who are saying, well, it's gone too fast or you didn't have enough examination of it, it has gotten a very, very strong stamp of approval now from the FDA. That's the facts. Go with the facts.
Dr. Fauci, thank you so much.
Dr. Fauci, thank you so much.
My pleasure. Good to see you guys.